So always, the first thing you want to do when you come across these hearts that are cut in half like this is identify right and left. The side with the thick wall, left. The thin wall, right. Notice on this one everything's reversed. So this is the right, this is the left. Now read the questions. If I ask what chamber this is, or right side, so right ventricle, right atria, left ventricle, left atria. This is the valve on the left side, bicuspid or mitral valve. This is the valve on the right side, tricuspid valve. This is the muscle that divides the right and left ventricle, interventricular septum. These little string-like structures here are chordae tendineae. These are the muscles that go to the chordae tendineae. Same thing here. Here's some more here. Those are the papillary muscles. Everything on the human heart exactly the same. This is the right, this is the left. So what chamber is this? Right side, right ventricle, right atria, left ventricle, left atria. This is the valve. It's on the left side, bicuspid or mitral valve. This is the valve on the right side, tricuspid valve. These are the muscles, papillary muscles that go to the chords, chordae tendineae. This is the muscle that separates the ventricles, interventricular septum. This is the muscle that separates the two atria, interatrial septum. You'll notice I skipped interatrial septum on the cheap part because it's kind of complex. It's hard to see on that one. All right, so those are the things that will be responsible on the hearts that have been cut in half. Then we got the coronary arteries of the heart. These are the most frequently missed heart questions. You might see this particular heart on the test in this position like this, or you might see it in this position like this. So when you look at it, you have to first evaluate, is this posterior or anterior? This is posterior. This is an anterior view. All right, so what do we use this for? I use it just for the coronaries. Aorta, coming off the aorta, right coronary artery. Branch of the right coronary is the marginal branch of the right coronary. This branch here is coming off the left coronary. We can't see it because it's behind this. That is the pulmonary trunk. If it's coming off the left coronary, it has to be the anterior interventricular branch of the left coronary. That's basically what you can see on an anterior view. On a posterior view, this is the right coronary as it came around from the front of the heart. We're on the posterior side now, so that is the right coronary. This is the posterior interventricular branch of the right coronary. This came off the left coronary. That is the circumflex branch of the left coronary. This space here is missing something. The coronary sinus has been cut out, but this is still there. That is the opening of the coronary sinus. On the reason why these are the most missed questions on the midterm exam is because we do things like circumflex branch of the right. That's wrong. That's incorrect. This is a circumflex branch of the left. We do things like posterior interventricular branch of the left, and that's incorrect. It's the posterior interventricular branch of the right. Same thing for this view here. This is anterior interventricular branch of the left. Make sure you remember that's the left that it's coming off of, because one of the choices will say anterior interventricular branch of the right. Okay? So that's why they're missed questions. So make sure when you're studying you get those straight. This particular heart is the same types of questions. Again, you might see in this position where you're looking at what are we looking at? This is the anterior view because that's pulmonary trunk and that's ascending aorta. Or it might be in this position. That's a posterior view. Here's the aorta. It's coming at you now instead of going away from you. That's inferior vena cava. So from the posterior view, what's nice on this heart that we can see very nicely? Well, there's the right coronary. This is the posterior interventricular branch of the right coronary. This one has the coronary sinus intact, so that's coronary sinus. Now, circumflex branch on this heart we can't see because they cut this hole in the right ventricle, because there it is, it's been cut. The left coronary, by the way, in both of these is behind this pulmonary trunk, so I don't think I don't point to that one at all. But this one, that's fair game. Anterior interventricular branch of the left coronary. Here's the right coronary, and again, because this hole's been cut open in the right ventricle, we can't see the marginal branch of the right coronary. So in my class, I use these specifically for coronary arteries. Okay. On this one, this is what we used to use for coronaries. We only just got these, by the way, just before COVID started. So this is what I use for the other things now. Anterior view. Why? Because that's pulmonary trunk, that's ascending aorta, that's the aortic arch. Same thing. This is just two different hearts, but it's the same exact thing. This is pulmonary trunk. That's ascending aorta, and that's the aortic arch. Superior vena cava here, superior vena cava here is kind of flopped down there. And that's as it goes into the right atrium. All right, now what we like to use this one for, at least in my class, are the three branches of the aortic arch. This is a human heart, so it's three branches. There's the brachiocephalic, left common carotid, left subclavian. The two branches of the brachiocephalic is right subclavian, right common carotid. The two subclavians are on the outside, the two common carotids are on the inside. So that's the pattern across the top. You just have to remember this is brachiocephalic here. Everything here is exactly the same. Pulmonary trunk, ascending aorta, aortic arch, brachiocephalic, left common carotid, left subclavian. Over here, right subclavian, right common carotid. Do not forget this guy over here. We like to throw that guy in there sometime. We get 3 questions on this particular station, and that is the pericardial sac. More correctly, it would be the parietal pericardium, but we don't get that specific on the test. And that's all your heart stuff. Sound good?